Sherry. And you know, April is Autism Awareness Month, and statistics show the autism rate has steadily increased over the last 20 years. Autism affects 1 in 68 children now. And joining me this morning is Dr. Eileen Shi with Healthcare Partners to discuss Autism Awareness Month and the vaccine controversy surrounding it. Good morning.
Good morning. How are you?
Good. So let's first talk about the spectrum disorder and how prevalent it is. I feel like we hear more and more about it, more parents talking about it now.
I think we are definitely becoming more aware of autism because we're knowing what to look for in terms of the behaviors and the cues to look for in developmental factors. So, and pediatricians are also having more conversations and parents are bringing up the conversation. So you know that in children in young ages, between 18 to 24 months, is generally when, as a pediatrician, we always screen for developmental markers if your child is showing any signs of autism, which is mainly a social deficit. So your child might not be making the same kind of connectivity with other people in a group setting. He or she may be interested in an object or repetitive movements and not be making great eye contact with you.
Are there cases too where a child is diagnosed with this spectrum disorder later on in life as well, or is it pretty, you know, when they're very young?
There are cases that are diagnosed later in life, but we do think that autism happens in a young age, which causes sometimes a lot of the controversies with autism and vaccinations, because at a young age is when children also get vaccinated against these preventable diseases that are most dangerous to them. So at this age, it coincides at the same time where your child is developing and showing those deficits. So, but most of the time we do diagnose it early.
And let's talk about this controversy with vaccines and the perceived connection with autism. As a doctor, is there a link?
So far, scientifically, there's no evidence. There's been a lot of studies that's done that show no causality. So we know that there might be a time coincidence that they're colliding at the same time, but also autism, by definition, is also a multifactorial neurodevelopmental disorder. And so you would expect to see that in a child that's growing and changing.
What would you say to a parent who is very convinced that I don't want to give vaccinations to my child?
I think it's fair to have that any kind of opinion regarding vaccinations for your own child, but the provider and the parent both should provide and coordinate the care of the child. So if you have any concerns or any hesitation, I would always talk to your pediatrician and bring up that conversation and really have a good heart-to-heart to find out what's a good common ground for you two.
And how about treatments? Let's briefly talk about treatments for children with autism.
Treatments for children with autism is a lot of early intervention. We do know that the earlier you intervene for a child, the better the outcome will be. So if you have that concern, you're seeing some suspicious behavior that your child is not quite making the eye contact with you or not making that connectedness with you, bring it up to your pediatrician early, and a lot can be done when it's done early.
It's good to have that discussion in the very early stages and talk to your doctor about it. All right. Well, thank you so much for joining us this morning.
Thank you for
your insight. The time now is 6:26.